Hello, my name is Todd Kolchek, individual couples and family therapist living in Iceland. Thank you so much for joining me as we explore how we can make mental health care more accessible to the Icelandic community.
So what we need to do is we need to open up the hours and that people are really seen to, they are not just sent home. And also family therapist is really, really important to have a family therapy. And that's what I also think when you come to the whole thing of mental health in Iceland, within the hospital, there's the family in the hospital, they are not really involved.
Okay.
It's quite often like that. This is really not good. My name is Birna Matthíasdóttir.
Okay, what is the name of this facility?
The National University Hospital of Iceland.
You work in the eating disorder unit.
Yeah.
Okay, and you're also art therapist.
Yeah, I work as an art therapist.
Okay.
This is an eating disorder unit for adults, and it's a daycare center or day center and outpatient center. Most of our patients are outpatients. We only have we can take 6 or 8 in here into the day center.
Okay. What challenges do you see around accessibility to mental health care?
Down at the hospital, the emergency unit, it's closed. It's open between 8 o'clock until 4 o'clock, and it's closed during the evenings and nights.
Okay.
So you have to wait until the day after. People have to be quite unwell to get in, to be admitted. If they are feeling very depressed, for example, but they are not thought to be suicidal, they are sent back home.
Okay.
And then might be contacted, 3 weeks later. Well, what they are changing now is they are getting psychologists into the local clinic. At the moment, it might be one psychologist for I don't know how many patients, every 1,000 patients or something like that. It's quite a lot. But at least they are trying that. In my unit, it's very accessible because people can refer themselves. They can just write to us, and then we will be in touch and put them on a waiting list. So people come here, mostly girls. We only have very few guys. They get therapy, individual therapy, either with a psychologist or me. Psychologists are trained in CBT. We use kind of a mixture of everything here. And the groups, there are groups as well. CBT groups, there's also a group for body image, there's art therapy group. We also have special unit that I kind of developed for women, mostly women, with binge eating. There's a nurse, there's alcohol and drug counselor, there's a doctor, there's a psychiatrist, a nutritionist, and family therapist. Because we are getting girls 18, sometimes a little bit younger, 17. And it's quite an important thing to work with the family, not only work with the individual. If you have a partner and you have an eating disorder, it's going to connect.
What actions do you think need to be taken?
Yeah, I think we should start when they are from kindergarten. Because if you have a kid like first graders, second grader, in primary schools and secondary schools, if something happens, something's going on with the kid, usually it's just the kid that is taken and what's wrong with you? Okay, we diagnose that, and then we maybe send you to somewhere if we can, and usually the family is not taken as a whole. The problem is usually not only that kid. The kid is not the problem most of the time, but of course, different things that is going on. But there are social problems as well with those parents. I worked in a school as an art therapist with kids from 6 to 16. just couldn't stand it because I took a kid into my office, and there we were, once a week, and then the kid went out home to the same things, and nothing changed.
So we need to involve the family more.
Yes.
Or what do you think is keeping parents from coming to therapy, or adults? What do you think is keeping adults from coming to therapy?
Well, if you talk about parents, I mean, I think if you're a parent, you have a kid, it's very difficult to find help for your kid, really. You have to do a lot of the work yourself, if you have to go, I mean, there are private clinics, they're really expensive. And you try to, I mean, like the hospital, the general hospital, where the main psychiatric unit for kids is, it's a long waiting list. If you want to take it to private clinics, as I say, it's very, very expensive. And also, I just think the schools are just not addressing it enough. So I think it's financial things for one thing, but also the mentality. It's also in Iceland, I mean, going to therapy is not they're tough Vikings, aren't we? Also men.
And men. Okay. So for men in the Icelandic community, it's
a no-no. Really. I mean, for example, this house. I mean, this building here. It's 2 units. It's like an eating disorder unit, and then it's also
personality disorder. You were saying.
Yes. And this house consists only inside of women. The staff is women, and most of the patients, they have occasional man that comes, into the personality disorder unit. We have had men here, of course, very few. And unfortunately, I don't think, I mean, there are lots of guys with eating disorders out there,
Well, we've even talked about this, that usually it's diagnosed as something else.
Yes, exactly.
Eating, to have an eating disorder as a man.
Okay, either you are gay, well, mainly you are gay, or a wimp, this is ridiculous. But of course, eating disorders in men, they have a little bit different, what do you say? I mean, they do different things sometimes.
Steroids, drugs.
Exactly.
So is it? Do you find that it ends up being diagnosed as substance abuse rather than eating disorder? We're kind of avoiding the deeper challenge.
Exactly. But also, men just don't. I mean, they have this idea. Also, older people, my generation have this idea about eating disorder in general, that it is the disorder of 14 to 20 years old girls, which is, I mean, my oldest patient was in her late 60s. So, I mean, they can be any age.
Oh, yeah. Absolutely.